At the age of 53, William Earle finds himself on Medicaid and confined to a wheelchair at the Cedar View Rehabilitation and Healthcare Center in North Austin.
I was in perfect health. You know, I could have climbed the Mount Everest if you'd asked me to.
A cancer diagnosis 11 years ago was followed by a debilitating stroke. With budget cuts looming, he worries for the residents here.
The food's going to be lacking. The staff is going to be overworked.
At 52, Diana Creamer's face appears to be the picture of health, but a motorcycle accident 4 years ago left her paralyzed from the mid-torso down.
That's the reality. This is the face of Medicaid. And there are a lot of faces that can't sit here and be on camera and speak. They can't even talk. They can't feed themselves.
Medicaid is her lifeline, and for now, this facility is home. But if the legislature can't find about $1.2 billion to fully fund payments to providers and anticipated caseload growth, the industry says up to 60,000 jobs could be lost, and about 45,000 residents could be sent away.
Some of these families cannot take care of the level of care their loved one requires. Some of them are requiring wound vacs, IV therapy that could keep them out of the hospital. We do here at our facility that would cost them more money to put them in the hospital.
Cedar View is owned by Mason Health. Its president and COO, Derek Prince, is also vice chair of the nursing home community's lobbying arm, the Texas Healthcare Association.
I think they certainly understand that we're at an Armageddon situation for nursing homes.
He says statewide, up to half of the nursing homes in Texas could close, especially those where at least 70% are Medicaid patients. Providers don't know where they'd send these residents. Some have no family, others require special care around the clock.
Not to mention that these lawmakers have put this system in place. We strip all of these residents of all of their assets before they can even qualify for Medicaid. And because we have mismanaged as a state our budget and our revenues, that we're now going to tell them, we've stripped you of your assets, you've got to figure out how to do this on your own and put it back on the private citizen. I disagree. I think that's wrong.
State Representative John ZERWAS chairs a budget subcommittee on Health and Human Services. He says they hear the public's concerns.
I've told people that when we pass this bill out of the House, that really begins the process of negotiating this budget and getting it to a place that will be comfortable for everybody, but clearly one that's going to be much more conservative than what we've had in the past couple of years.
Democratic Representative Sylvester Turner disagrees and argues the state could resort to its savings account known as the Rainy Day Fund.
Nursing homes will stay open if Texans demand that policymakers like myself do the right thing.
For now, residents like William Earle will take full advantage of the treatment they receive through facilities like Cedar View.
I'm going to try to get to where I can walk so I can get out of this chair.
Earle says he's lucky he's a short-term resident. Others are here for the long haul, their futures determined by lawmakers miles away in the State House.
All in all, these people are just here, and none of them want to be here. They would love to be back with their families, but they just can't. Their families either won't or can't take care of them.
Diana Creamer is certain cuts will mean she'll lose her Medicaid benefits. She can only describe the fear one way.
I'll go to another level of hell. If you have no family, if you have no friends, if you have no place to go, and if you need constant care because of a medical condition to no fault of your own, to me, it's heartless, it's abject cruelty to have these cuts being made to people that desperately need this.
In Austin, this is Ton Tan with the Texas Tribune.